Erica Wilson, 414974, and the date is the 5th of the 9th, 2014. Hi, Laura.
Yes. Hi.
Erica Wilson, nice to meet you.
Nice to meet you.
How are you going?
Good, thanks.
That's good. I hear you wanting to join the gym and start a bit of an exercise program.
Yes, my doctor said I need to start to get healthy, otherwise I could be insulin dependent.
Oh, okay, so you're a diabetic?
Yes,
Yes,
type
so
2.
Type 2? Okay, we'll have a bit of a talk about that later. We might fill out some of these forms first, so this is just going to be a bit of an induction session today. Unfortunately, the paperwork does have to be done. So this just basically lets me see your health, your current exercise ability, whether there are any contraindications for exercise, such as probably your diabetes, and just your motivation and goals behind wanting to do this. So we'll start with the pre-exercise screening tool. So what I'll get you to do is just fill out the top section, so just your details there, your name and date of birth. Yep, perfect. Alrighty, so just a couple of questions to ask you to start with. So has your doctor ever told you you have a heart condition or you've ever suffered a stroke?
No.
No. Have you ever had any experienced any unexplained pains in your chest at rest or during physical activity? No. Do you ever feel faint or have dizzy spells during activity? You don't lose balance at all? No. Have you had an asthma attack in the last 12 months? No. So with your diabetes, obviously you're a type 2 diabetic, have you had trouble controlling your blood glucose in the last 3 months?
It's medicated.
Okay. And obviously if they're worried about you becoming insulin dependent, you have probably had a little bit of trouble
Yeah,
there.
Somewhat, but yes. So
Okay.
yes to that one, I guess.
Yeah. Do you have any diagnosed muscle, bone or joint problems?
No.
And nothing that will be made worse by physical activity? No. Excellent. And do you have any other medical conditions that will make it hard for you to participate in exercise?
High blood pressure and high cholesterol, that is also medicated.
Okay, yep, that's alright. We can work around the high blood pressure and the cholesterol, so that's fine. And I will ask you about those later on as well. So just in terms to the diabetes, I will send a referral letter off to your doctor, just if he's got any recommendations or anything like that, and just to completely clear you for an exercise program.
Cool.
Alrighty. So now, I'll copy that over in a second. So your age, you were 1970, weren't you?
44.
So 44? Perfect. Now, is there any history of heart disease in the family? Stroke or heart attack? No? Excellent, that's great. And do you currently smoke? No, excellent. Now, your current physical activity and energy levels, so do you exercise at all at the moment?
No.
No? So you tend to no walking or anything like that?
Not really, I sit down at my job, so...
Okay, yep. So you work in an office?
Yes.
Yep, okay. And do you know your height?
165 centimetres.
And your weight?
79 kilograms.
Okay, so yeah, have you ever been told you have high blood pressure? So say yes to that
Yes.
one. And the same with high cholesterol?
Yep.
Yep. And have you ever been told that you have high blood sugar levels? I'll assume that with your diabetes.
Yeah.
So unfortunately that's a yes to all of those, but they are things that we can work around. So the next one is your medications. So you're currently taking any medications? I assume just for the blood pressure and cholesterol. Yeah. Now you haven't spent any time in hospital over the last 12 months? Injury? No, nothing? And are you pregnant or given birth in the last 12 months? No. Do you have any muscle, bone or joint pain or soreness? No. Excellent, that's great. Okay. So based on your height and your weight, your BMI is 29.5. So is in the overweight category. So that's fine, we can work around that. I will also take your blood pressure today just to see how that's tracking as well. I'm sure you've had this taken a fair bit. Sorry. My fingers are a little bit cold.
That's alright.
There we are. So just rest your arm down there. Excellent. Can I get your dose in there? Excellent. So it was 118 on about 76. Alrighty. So that's great, that's within the normal range. So the 118, that's your systolic blood pressure. So that's the pressure in your arteries when your heart beats or contracts and ejects blood. The 76 is your diastolic blood pressure. So that's the pressure in your arteries when your heart's relaxed and refilling. Okay, so I've got another form here for you to fill out. So this one here, I might get you to fill this one out. This is basically just for me to get a bit of an idea of your exercise ability and what sort of goals and things you'd like to set for yourself. So I'll get you to fill that one out. That's alright, we can fill that one in later.
No.
Okay.
Probably on the verge of bad.
Okay. So yeah, you feel bad as well, or just in terms of your health?
Just in terms of my health, and my doctors really said I really need to get onto it.
Okay.
Yeah.
So 5 being the most important, 1 being the most important, 5 being the least important.
Okay.
Yeah, excellent.
Just recently, so like, because I saw my doctor, so like maybe like 1 week.
Yeah.
Should I just put anything in there, or?
So you're fairly happy to do as much as you can to achieve this goal and make yourself healthy? Yeah.
So no?
No, okay.
Not at the moment.
Yeah, okay, so you said you worked at a desk job. Yeah.
Yeah. Probably like...
And you work 5 days a week, don't you?
Yeah, so probably like, I guess like 2 days a week for a weekend.
Yeah.
Maybe afternoons, but...
Okay. So these are just the types of exercises or activities you're interested in. So that just gives me a bit of an idea on what to base your program on as well.
Yep. So maybe like walking, some weight machines maybe.
Yeah. Okay. Yep. Cool. Great. I'll take that into consideration. So basically your main goal is to reduce your body fat.
Yeah.
Okay. And you've obviously been told you need to lose weight by the doctor because of your diabetes. Now, do you have a particular amount of weight you'd like to lose?
Probably like about 15 kilograms.
About 15 kilos?
Yeah.
How do you say you're 79 at the moment? Okay, so that is a lot of weight to lose. So we usually start with small goals and then also have long-term goals.
Yeah.
I'd probably recommend that we start with perhaps a 6-week goal of trying to lose 3 kilos.
Yep.
Because that's an achievable and it also gives you a goal that you hit in the short term. In the long term, 15 kilos, does put you a bit below or in the healthy range, but yeah, a bit on the lower side. So would you be happy perhaps if we started at looking at perhaps say 12 kilos, that does get you into the healthy range, and then we can reassess by then.
I'd be happy with 12.
Yeah. So we'd look at probably 12 kilos over 24 weeks.
Yep.
Because that's a healthy and sustainable way to lose weight.
Cool.
Excellent. Alrighty, so this just basically has given me a bit more information on what to base your program around. There are a few things just in terms of your health and your ability. With your blood pressure, it obviously is very well managed at the moment, but there are some exercises that we should stay away from. So any isometric exercises, so they're holding exercises like the plank, anything that involves holding your breath. Breathing is really important, especially with blood pressure, but I'll explain some good breathing techniques later on. Any overhead movements, and anything where the intensity is greater than 75%. So all of these do increase your blood pressure, which it is well managed at the moment, but just for your own health and safety, I'll steer clear from those.
Yep.
And I'll probably incorporate a bit more functional movements anyway, just because you'll get the most benefit out of them in your daily life.
Yep.
In terms of your diabetes, exercise can lower blood sugar levels.
Yep.
So you're probably aware of hypoglycemia. So basically what you need to do, it doesn't stop you from exercising, but you just need to keep a good track of your blood sugar levels, so check them regularly. Have regular checkups with the doctor just to see how exercise is affecting your blood sugar levels. Avoid erratic timetabling, so that's probably the main one. Have a daily routine, exercise at about the same time each day. You're obviously very aware of, the needing to eat at certain meal times, so keeping all of that set. Eating low GI carbs before exercising is also great as well, so things like a sandwich or a banana. And also just have on hand with you whenever you do go to the gym a fast-acting carb like a jelly bean, so that if you do feel like you are getting those hypo symptoms, you have something there to tackle it straight away.
Okay.
Well, that's about it for now. I think you've made the right choice by coming in and seeing me. I admire your motivation and determination to lose weight to increase your health. I think this will not only help with your diabetes, but hopefully lower your blood pressure and your cholesterol as well. So I look forward to working with you and seeing your results, and I'll see you next Tuesday for our next session.
Cool. Thanks.
Great.